There's a big difference between being able to take care of yourself and having to depend on someone to do it for you. The Skilled Rehabilitation Unit at Baptist Rehab Germantown is helping people to learn to recover from injuries and illness. Rod Starnes explains now how skilled rehab is a bridge for patients ready to leave the hospital but not quite ready to go home.
It's been about a week since retired teacher Dale Lowry had ankle surgery. She needed the operation after a misstep in her garage. She was discharged from the hospital, but she wasn't ready to get around her house on her own. So Lowry is getting therapy at the Skilled Rehab Unit at Baptist Rehabilitation Germantown.
The Skilled Rehab Unit here is a program specifically designed to treat certain conditions after they have been discharged from an acute care hospital. We target patients who have had, for example, joint replacements or who have generalized weakness.
Changes in government regulations make it tougher for patients to qualify for inpatient rehab in hospitals. The Skilled Rehab Unit opened in late 2010 to provide an inpatient alternative for people who need both physical and occupational therapy as a bridge between hospital and home. The physical therapy helps patients regain strength and the ability to move without pain. Occupational therapy helps them manage the everyday functions of life. Baptist Rehab administrators believe the new unit is already a success.
Right now our average length of stay is 12 days, which was actually less than we had even projected when we started out with our unit. So we have even surprised ourselves with our length of stay.
During that stay, occupational therapy extends into patients' rooms, where therapists will work with them on tasks that may seem ordinary, like getting an item out of the closet. But it's important that people learn how to do things in ways that don't disrupt the healing process. In Dale Lowry's case, it will be a while before she can put much weight on her ankle. The program is intense because patients have to reach certain goals before they go home.
When we talk about levels of therapy, for example, if they were in an outpatient therapy program, they would maybe come in 2 or 3 times a week. But in our program, the patients are admitted to the hospital or a inpatient unit, and they receive 5-day-a-week therapy. They have nursing assistants as well, and they're able to do more consistent therapy. For example, 2+ hours, almost 2.5 hours a day of therapy.
An important aspect of what the new unit provides is the skill in the skilled rehab. That's so patients will be better able to take care of themselves once they get home.
Well, they're very successful in going home. We are looking for people who we anticipate going home, and our success rate is about 85% in the 7 months that we've been open so far.
Therapists do detailed assessments to determine what will help their patients. Exercises are assigned that help regain strength. One patient who's now home after a total hip replacement credits his progress to the way the program was designed.
Well, the thing that really worked well for me is I knew I was coming to an environment where there were people who took care of just these sorts of things for hip replacements.
Another important part of the skilled rehab process is knowing what people face after they leave the facility.
We like to ask a good number of questions, very specific questions about their home setup, and that happens even before they are admitted to our unit. And then, of course, we continue to ask those questions, looking at certain things like stairs. Will they have to, do they have carpet? Do they have equipment at home? Or if there are any what we call barriers to them being able to get back home.
How well people are doing is measured throughout their stay, so it's easier to determine the level of outpatient therapy they'll need once they go home. Because of the skilled rehab unit, they're better prepared for the next step in their recovery. For Smart Medicine, I'm Rod Starnes.